name is Amol Nergadkar. I'm the CEO of Patient Prism, and I'm delighted to welcome Dr. Acierno from DecisionOne into our studios. And we've been talking all things DSO this morning, from starting one practice to scaling up to 25. And one of the questions that I talk to a lot of dentist entrepreneurs about is that there is a shift, right? At one point, you have to make this shift from being a dentist, a clinician, to being a business owner, an entrepreneur, and a CEO now of a larger group. What's that shift like, and what are those? What differentiates a clinician dentist from a CEO, an entrepreneur dentist? What are those things?
So the first aspect is that your mindset can never change from what it's being like to be a clinician, in my view.
Okay.
So you are establishing a DSO, a dental support organization. So patients, doctors, and team members have to be first.
Okay.
No matter what, if you're a CEO of 9,000 people or a CEO of 10 people.
Sure.
So our dentists, our private practices, they are CEOs. They're CEOs just of a smaller group, right?
Sure.
And so your mindset changes by scale of the amount of people.
Okay.
Not necessarily, and the fact that you can't touch them. That's the mindset change. Other than that, you still got to get people to believe in a vision. You still got to get them to follow something that you're trying to do, right?
Sure.
You still got to empower people and give people trust, right? You still have to treat patients unbelievably well and establish systems within that office.
Sure.
Now the question is, bringing it into a different location, a different place where you can't touch it, how do you know that those systems are going to continue to move forward and going to continue to thrive in those practices because you can't touch it every day? That's the shift.
Is it a control issue though? Is it control? Do you as a dentist clinician feel that you need to be in control? And then now that you have many offices, that control doesn't exist.
It's a little bit of that. It's mostly the fact that usually an entrepreneurial dentist is super successful in a private practice, right?
Sure,
if you're not successful in your own private practice, you probably shouldn't scale up,
That's
okay?
right.
So if you're really successful, and part of that success, if you go and you meet a lot of them, which I do a lot of them, there's so many out there, and you meet them and you know right away he or she why they're really successful.
Sure.
I mean, they have a persona, they are able to connect with patients, they have relationships with their team members, they're a good leader, those type of things. Now the question is, just like if you have a really good office manager and now you ask them to do 3 offices.
Sure.
Some of those leaders have a really hard time now moving to other directions to where you can't touch everybody. And that's that shift, yeah.
Wonderful. What else is relevant?
So I would say building infrastructure. Building the infrastructure is a big difference. In dentistry, you have front desk, assistants, hygienists.
Right.
Pretty simple, right?
Okay.
And once you establish a DSO, now you're into IT, marketing, supplies, HR, M&A, legal, accounting. You are learning and you are seeing a whole different world than you ever have been in. Especially the world that I came through, because I came through science and dentistry.
Sure.
Never won business class in my entire life. So you got to surround yourself with really good people that know it. Because if you're planning on knowing it all, you will not be able to scale up.
And that's sometimes I've seen that as I've best friends with dentists over the last 20 years, and some of them are so inquisitive because they're inquisitive by nature. That's why you go into medicine and healthcare, is you are inquisitive, and sometimes that comes in your way because you want to know everything and you want to master everything.
I was at a conference on a panel, and I remember somebody asked me, "What software do you use in accounting?"
Yeah.
And I was like, I don't even know if we use software. I was like, I know my dad's here somewhere. Yeah. Somebody asked him that question.
Right.
There's certain things that you have to entrust people with. It's the same thing. I buried my head for 15 years in somebody's mouth, right? And worked on somebody. I had to trust somebody at that front desk that they're going to collect the money. I had to trust them that they were going to make the phone calls, and I got to do the same thing as a CEO with all my departments behind us.
So really, it's the mindset that first you have to make that shift.
That's correct.
Into from one to many, and,
right.
and the problems that come with it, and the challenges. Building infrastructure is number two. Really, you have to focus on that. That's where you have to shift your gear towards, because that's not what you learn in dental school. Right. You don't learn to build infrastructure in dental school. You just learn to serve your patients, and really it's people and systems at the end, right?
So then people and systems really rounds it off, right? Making sure that, and that's part of your culture, making sure that whatever your culture is, our culture, it's people and systems.
Sure.
So making sure that you never go off of that, because it's very easy to go off of it.
Okay.
As you know, when you have 5 offices and you have 2 team members that don't get along, maybe once every 2 months, maybe once a month, now quadruple that, and you got 5 fires a month, right? Making sure that your people skills and your systems that you have running your office are really honed in, that people understand clarity, right? There's I love Disney, I love looking at it. There's a Lee Cockrell who is in charge of a lot of systems over at Disney.
Sure.
And he always says clarity is the best thing in leadership, right? And making sure you're clear on how you want to treat people. And when I say treat people, I mean treat team members, treat doctors, and treat patients, right? You want to make sure you're clear on that. You want to make sure that there's clarity in the systems and the expectations of the systems. We always say our systems in our office is like a road. You can go this way, this way, this way on the road, just don't go off the road, right? We want them to feel empowered to be able to change that. So people and systems, that's really important in the mindset.
These are absolutely fascinating tips to get. I think that's where I think a lot of dentists who are looking today to kind of participate in this next generation of growth in dentistry and become dental support organizations, they need to really be mindful of these 3 concepts. And you've learned this from your own mistakes too. I mean, all of us, and as we grow our businesses, we kind of wish we had done things differently, and this is exactly what you need to know. So this is fantastic. Thank you so much.
Appreciate it.
We'll continue the discussion.
Absolutely.
Thank you.